As cancer touches so many people, what about when a child learns of a cancer diagnosis for a loved one? Mackenzie Glenn is a child life specialist from Hall Perrine Cancer Center in Cedar Rapids. Mackenzie, thank you for making time for us to talk more about this. What's really the best way to approach a child when this devastating news can really come back from a family member or really a loved one in this young person's life?
Right. Really what I talk to families about is, you know, it comes down to, you know your child the best. So you're going to be that expert when it comes to talking to your children. So it really depends on the diagnosis of the parent or the grandparent, the child's age, a lot of factors.
Now, there are a lot of factors you talk about. Even they could be with the same parents, but children can be radically different from the first one to a second one to the youngest one. What are some of the ways, though, that children can typically be affected by once they come across the reality and trying to take in the grasp of a cancer diagnosis?
Yeah, routine changes. You know, a family member's not going to be around as often because of, you know, not feeling well. They're going to
treatments and everything else,
right, exactly. There's that thinking of just the parents not feeling good or having to go to grandma's or aunts or, you know, having other people help take care of the children.
I like to say with kids, if something difficult comes up, I'll say there are no magic words that can stop this, really.
Right.
But what are some of the more proven strategies that you work on when trying to advise family members on how to really break the news of something like this?
Yeah, honestly, again, goes back to, as a parent knows the child the best. But I like to tell parents we use, you know, be as upfront with them as you can be. You know, if they're 13 and they want to know all about it, give them as much you know, as much as you can give them. And it's okay to say, I don't know. Because, you know, cancer is, we don't really know always the outcome. And so being able to go off of that.
And I know we do have resources available there at Hall Perrine where you're at.
Yeah.
What are some of those?
I use a lot of, as me as a child life specialist, I'm able to meet with the kids and find what, you know, what the kids need the most and what can help them the most. I have books, I do tours, so children understand where their parents are at.
Again, it's something that really can impact so many people, but it's something that may also not be thought of as much because once you hear the diagnosis, you know, once the word gets out, but especially with the younger people, you have to be very sensitive about how you try to break the news and inform them, so we appreciate it.